This is the 3 East Peritoneal Dialysis Manual Exchange instructional video. The first step is going to be to verify your order. So the provider is going to place an order for peritoneal dialysis manual process. In this order, you're going to have the filled in amounts for your fill volume for each exchange, the dwell time for each exchange in hours, the total number of exchanges, and if the last fill is supposed to be with icodextrin or not. That icodextrin order is typically used for when we put patients on the cycler if they need a manual exchange afterwards, but sometimes in 24 hours the provider will want to use icodextrin to pull off a little bit extra fluid with the last exchange, so just be mindful if that does say yes. If the fill volume ordered is less than 2 liters, we're going to have to use the scale to ensure that the proper amount of volume is administered, and we're going to show you that a little bit later in this video. Once the doctor orders the bags, they're going to populate into your MAR, as you can see on the right-hand side. Just be mindful that sometimes when the physician orders the bags, they're all going to go in at the same exact time. For instance, if the doctor wants 4 manual exchanges every 6 hours over a total of 24 hours, all of your bags may populate into your MAR at, let's just say, 9 a.m. So you may have to go in and physically space out those bags so that they're every 6 hours for you to sign out. Just be mindful though that they do pop into your MAR, but you may have to sign and space them out. The next step is for you to gather your supplies. Instructions on how to override your PD bags are located near the Pyxis. Just remember that you may only use 2-liter bags for manual exchanges. You can never use the 6-liter bags. For the sake of the manual exchange, the supplies that you're going to need are going to be 2 blue hemostats. You can never use the metal ones. They dent the lines and then it doesn't let things flow, so you have to use the blue ones. You're going to need 2 masks, a mask for yourself and for your patient. If there's anyone else in the room, they must be wearing a mask as well. Hand hygiene supplies, gloves, a PD mini cap, which is on the right-hand side of that one picture, the bottom, and then you're going to actually just need your PD bag. So the first thing you're going to do is place a sterile sign on the door, wash your hands, don gloves, and mask up. Then you're going to check your order compared to the bag that you have just to make sure that it's exactly what the doctor ordered, you have the correct bag. After the bag's warmed, make sure that you do warm the bag. You can either wrap it on a K-pad or put it on the cycler for at least 20 minutes. You can hang it on the pole and then place a clean chuck on the floor and put your drainage bag on the floor. Then you're going to clamp the unprimed fill line with those blue hemostats. And then you can untape the patient's line, and then we like to just put an extra hemostat on their line just to make sure that no fluid is getting in or out, even though the patient does have a clamp on that very end of the catheter right there. So you're going to leave the drain line unclamped as we're preparing to drain first and then fill and prime later. Then you can grab that little circle, pull off that colored end of your bag, and then unconnect that white cap and twist on without touching anything. So now the bags are connected to the patient. You're going to break that flange. You're going to unclamp the hemostat on the patient line and then untwist their catheter, and they're going to begin draining. You can notice that Bridget put the extra hemostat on the fill line just to make sure that we're really not putting any fluid in. We're just allowing the patient to drain. We're going to leave them drain for about 20 minutes. If they're having trouble draining, you can always have them turn, stand up, sit down, whatever works. Once they're done, you can twist that off. And now we're going to fast flush the line. That means we're going to prime the line and fast flush anything through that could be sitting in the line. So we're going to break that green flange, and then we're going to remove the hemostats on the fill line. The patient line is closed, and we're going to count to 5, letting that fluid run into the drainage bag and prime the lines. When we're done, we're going to clamp the drain line, and then we're going to twist open the patient's set, and we're going to allow them to fill. As we said earlier, if the patient is to be filled with less than 2 liters of fluid, you're going to have to place the bag on a scale and carefully watch until the correct amount of fluid has instilled. Filling can vary the amount of time it takes to fill a patient. Some patients fill quicker than others. Typically around 20 to 30 minutes the patient will fill. So once they're done filling, we are going to have to twist off to clamp them off, and now we're going to get ready to disconnect. So we're going to clamp both the fill and the drain line, get our PD mini cap, open it without touching anything, and then we're going to twist and place on the mini cap. We then can tape the catheter back up so it's not pulling on the patient, and the exchange is complete. Now we just have to document in Epic. So documentation is done in the peritoneal dialysis flowsheet in Epic. Remember that for a manual exchange, the drain amount is documented in the previous exchanges column, along with the effluent color and the balance for that exchange. Then once you start to fill the patient, that's going to be in the next or newest exchange. So for the volume instilled, you're going to create a new exchange column and document the exchange number, type of solution, solution additives, and the volume instilled, which is under volume in. Just so you're aware, there are also documentation tips, troubleshooting, and how-to cards that are found in the PD binder in the 3 East PD area if you ever have any questions. Once you've documented it, your manual exchange is complete.